Medical workers of Reddit, what's the craziest lab result you've seen in a patient? Story 1 sent a patient for an ambulatory sleep study when he was referred to us for suspected sleep apnea, was very tired and apathetic when he came in. His test came back with an AHI of 127 with the longest apnea episode lasting 77 seconds, essentially meaning he was stopping breathing 127 times every hour. Called him back in urgently to start a CPAP trial, moved to VPAP, and last I had seen him he was happy, cheerful, and about 35 kilograms lighter than when we initially saw him. Story 2 not technically lab results, but on intake my best friend's pulse ox was 44, the oxygen she was getting was purely through agonal breathing at that point. She was immediately rushed back, put into a medical coma and intubated, life support for 4 days, ICU for 6, she had a triple whammy of influenza, strep throat and pneumonia. Needless to say, she was incredibly close to death and it amazed everyone that she made it. Story 3 elderly woman with a pulse rate of 8, I figured the pulse ox was shitting the bed as they often do. So I told my coworker to take it off the patient and put it on me, to check if it was the machine acting weird or not. Coworker put the pulse ox on me and it showed a normal, healthy pulse rate almost immediately. My coworker and I looked at each other, looked at the patient, looked at each other again, and just went oh. Story 4 as a lab tech I've seen quite a few. The highest glucose I've seen was 1750, highest accurate potassium was 7, 9 rule of thumb is 8 and you're big dead. Hemolyzed samples make it shoot up so it's likely not real, but that one was, I learned our lactic acid analyzer only goes up to 40. That guy unfortunately didn't live long. I've seen a urine sample with so many crystals I couldn't see anything else. My most recent was an 89-year-old man with what appeared to be a lot of very healthy looking in his urine sample. I was shocked at the quality and quantity of them all. Story 5 I recently had a hemoglobin level of 5, and I overheard my nurse telling everyone else at the nurse's station she went to work today, with a laugh, if this is extreme, but every nurse and doctor was like no you're tired all the time. Story 6 next week is National Lab Week. Thank you to all the unsung heroes in the labs. So many people think, oh, the doctor ran some tests means the doctor physically ran the tests. There's an entire department at hospitals spitting out this critical data. If you think nurses are underpaid, I've got an update for you. These professionals have college degrees but are chronically overlooked. When our hospital was aiming to have all employees make 20 hours, no mention was made of raising the starting MT salary above $23.25. I wonder what it is today. Story 7 my mom was a type 1 diabetic. Her glucose frequently dropped at night when she was sleeping. I was home visiting and pregnant, had to get up to pee a bunch at night. Both my mom and I were sleeping on the sofas in the family room. I'd take a whiff every time I walked by to pee. Once her glucose dropped, she'd start sweating out the excess insulin. Low blood sugar sweats are something you can smell if you have been around it at night. She smelled low. I had a hard time rousing her. I got the glucagon out and got her food. But just before I gave the glucagon I texted her blood sugar. My dad was a real about using the glucagon injections because it was 150 for 3 doses, 20 years ago. I felt like I had to justify giving the glucagon. Her blood sugar was 12. It's a miracle the glucagon worked. I still had to give her Pepsi make a sandwich. I wish she had lived long enough to get a continuous glucose monitor. It would have completely changed her life. Story 8 I had a 10-year-old boy come into emergency for his diabetes. The finger result was so high it wouldn't give a measure, which means it was ridiculously high. Parents are saying he's always thirsty, but we only give him orange juice that has no added sugar, and McDonald's shakes. For anyone not aware, both these things may as well be pure sugar for someone with diabetes. Story 9 not a medical worker, but I scared the out of some once with a blood pressure reading was 60/40. I was 19 and felt totally fine, but the nurse triple-checked the reading before bolting out of the room and bringing the doctor along with near the entire medical team of the office in the room. Been since told I have chronically low blood pressure. Story 10 not a lab, but I had a patient walk in for an EEG. We chatted the whole time, super nice. Start the EEG, they were having a seizure every 30 to 40 seconds and had no idea. They drove there. Story 11 as a family member of the patient, I once had a family member test for an A1C of 19.2. Ideal normal range is under 5. 7 The staff at the hospital sounded both surprised and a bit horrified when they informed us of that result. Story 12 a sodium of 555. Yes, you read it right, we looked at him. He replied I don't feel so good, and dropped dead. I'll never forget it as long as I live. Story 13 common medical terms I have seen on this thread that people outside the medical field may not understand. CBC complete blood count, a test that counts the different cells in your blood. Like red blood cells carry oxygen, white blood cells fight germs, and platelets help stop bleeding. Hemoglobin HGB the part of red blood cells that carries oxygen around your body. Low hemoglobin can mean you're anemic, tired, and weak. Hemoglobin A1C a test that shows your average blood sugar over the last few months. Mostly used for people with diabetes. WBC white blood cell count tells how many infection-fighting cells are in your blood. High numbers can mean infection or inflammation. Platelets tiny pieces in your blood that help it clot so you don't bleed too much when you get a cut. Lipid panel checks the fats in your blood, like cholesterol, to see if you're at risk for heart problems. TSH a test to see how well your thyroid gland in your neck that controls energy and growth is working. Gestalt tests that check if your liver is healthy. BMP basic metabolic panel a group of tests that check things like your blood sugar, calcium, and How well your kidneys are working. INR shows how well your blood clots, especially if you take blood thinners. Story 14. As a lab scientist in Australia, brown snake envenomation always provide interesting results. Had one 22-year-old male who went into DIC following a brown snake bite and died with a hemoglobin of 22. He was a Jehovah's Witness so refused transfusion. Story 15. Not a medical worker but I have a mechanical mitral valve so I have to be on warfarin for the rest of my life. Told my friend who's a clinical pharmacist that my dose is 14 milligrams and he acted like it was crazy that I wasn't bleeding out right then and there. Apparently I just eat a lot of vitamin K so I need a really high dose. My INR is normally 20. Story 16. Addictions field, LFTs, serum gamma-glutamyl-transferase. Top end usually 130, patient's result was 5,980-ish. 3 bottles of red wine a day for many years. No idea if he's still alive. The scarier thing is when this result comes down, people believe they're getting better but it could be simply there's no liver cells left to measure. Story 17. Hemoglobin 1-9. She walked into the ER admittedly dizzy but still walking, then refused blood transfusions. Blood glucose 1,472. Stage 4 gastric cancer patient with uncontrolled diabetes. Woke up and felt fine after couple hours on an insulin drip. Blood glucose 19, rectal temperature 89, 6. Same guy, nursing home said he was fine 3 hours prior, NC00, came in for a fever, lactic 14. My grandma a week before she died of sepsis and pancreatic cancer. Blood pressure 312199. Big fat dude slipped in the shower and hit his head. Had a brain bleed the size of a baseball. Still awake, but very confused and pissed off as he got clofidipine. Troponin 23,500. I didn't know our lab had an upper troponin limit. Blood alcohol 6 every day for 3 years straight. Story 18. Not a medical worker, just the patient. Went in for follow-up after an ER visit and the CK test came back with 212,000. After being admitted a few more of the same tests came back as not readable. Pulled both thigh muscles and ended up with rhabdomyolysis. It was the start to a journey to Mayo for the diagnosis of McArdle syndrome. Story 19. A friend of mine had a glucose level of nearly 950. When the tech took the sample his face went white and said that's not good, I need to get the doctor. Turns out the feeling he had the last few days wasn't the flu, it was sugar accumulated in his body. For reference it's supposed to be between 75-100-ish. I've been in a fair few ER-worthy visits and I've never seen a doctor have any type of reaction like that before when she came in the room. Edit wild part about all this, he was diabetic for about 3 months, then his body figured itself out and he didn't need to take insulin anymore. He just watches what he eats and takes a needle test once a week. It's crazy. Story 20. Not a specific lab result, but one time I had to process a blood sample where the plasma looked like strawberry yogurt. Ideally it would be almost clear. Story 21. My friend was feeling off, tired, etc. He went to the and his oxygen was 51. He thought it was okay, B51 is a pass. Turns out he had a spontaneous one lung collapsed. He was also tall, thin and pale, which apparently many plea with spontaneous pneumothorax also have. Story 22. Not a medical worker but in the ICU with my son and doctor is discussing liver enzymes being high around 400, but he had a patient at 1K who ended up okay. Trade out with mom to take a shower and get text that my son was over 7K. Yeah, I definitely started panicking. Story 23. I've had a couple weird ones. Best ID ever felt in my life. Lost 60 pounds in 6 months with no real change. Doctor said keep it up. I said maybe we should test. I thought cancer. Did a blood test, blood glucose was 880, A1C 13 2 so diabetes. Went in with severe cramping, did blood tests, leukocytes was over 30,000, immediate emergency. They thought my pancreas was shutting down. Ultrasound showed huge gallstones, several days of nothing in my mouth, trying to get my pancreas to calm down. On the 3rd evening the nurse, I still call her Ratched, comes in and says they aren't going to do the surgery. Your leukocytes are still too high and I got scared. Oh no, how high are they? 5,000, she says. My wife and I started laughing. Don't laugh, you could die, they were over 30,000 when we came in. Don't you lie to me, she said. Oh please go check, I don't want to be wrong, that what they said and what I remembered. She came back a few minutes later. They'll do the surgery tomorrow. Was the last time she spoke to me. They removed my gallbladder the next day. Story 24. A tortuous, herniating stroke. The brain was twisting clockwise from the left temporal region and herniating through the foramen magnum. Symptoms were headache and dizziness for 45 minutes. Story 25. I am resident here. Our clinic often has patients who get lost to follow up. A patient came in just under 2 years after his last appointment where it was revealed he had a ferritin of 1. I repeat, ferritin of 1. Poor guy also had hemorrhoids and said he was bleeding every day, continuous fatigue. No kidding, nothing to replete your hemoglobin stores. The crummy part is that the ferritin was a lab from a while ago and he never followed up for intervention. We're on track now though. Story 26. Had a guy once with a platelet count of 2. Obviously not how it works, but always thought about just 2 single platelets floating around. Unsurprisingly and sadly he bled out the same day. Story 27. I'm not a medical worker, but I did give my doctor, in his words, a small heart attack. I had pneumonia and went to the doctor. They decided to do a chest x-ray. At the time, I was wearing a necklace that was very dear to me. A gift from my brother. It was basically a bunch of rope tied into all sorts of knots. with a pendant made of bone. The X-ray technician told me to take it off, and I explained that it wasn't coming off unless she brought scissors. The knots were everywhere, and I couldn't get it over my head. She made a gesture that I interpreted as, you know what, screw it, so I just tossed the necklace over my shoulder and went ahead with the X-ray. Sometime later, I got called into the doctor's office. He was sitting there, visibly shaken. He told me I had cancer, then showed me the X-ray, a solid black mass near the top of my lung. I panicked for a moment, but then I realized the shape looked familiar. After connecting the dots, I explained what has happened and even showed him the necklace. Turns out, no cancer, just plain stupidity. We both laughed nervously at the situation. Story 28 TSH 326, 16 Indian rupees, lactic 23, 3, K9, 6 and K1 2, Na 172 and Na 98. Double-checked that one while picking up the phone to call Nef. Blood glucose 1635, arterial pH 6, 665 was actually improved from unreadable, hemoglobin 3. 1 routinely see LFTs 10,000 and CK60K, ANC 0, 1 WBC 1 PLT 3 same patient. Thank God hemoglobin was 7. Trigs 986 ammonia 466 lactulose enema anyone, BUN 274, source ICU-PA. I keep a note on my phone of particularly interesting lab results. I have a friend in EM and they have a scoreboard in the lounge. I'd be interested to see. Disclaimer, in many of these cases the patient died very shortly after. Story 29 patient side here, but I once got a direct call from lab after blood test and technician was straight up asking me if I am alive and to get me to hospital, was during chemo cycle and apparently my neutrophils ceased to exist. Story 30 not a worker, but a patient. I had been suffering with chronic diarrhea and stomach cramps for months, and while waiting for yet another appointment with a gastroenterologist, I came down with a wicked fever. I tried just treating it with Tylenol Advil, but after about a week, they weren't touching it. I left work early on a Thursday and told my boss that I wasn't going to be in the following day, and went home to rest. After 1,000 Tylenol and 800 Advil, and soaking in a lukewarm bath for an hour, my temp was still 103. I decided to go to bed and go to the ER if I didn't feel better in the morning. I woke up in the hospital on Saturday. Out of the blue, my mom decided to stop in to see me, and found me unresponsive in my bed, soaked in sweat and feces. They rushed me to the hospital by ambulance, and I had a fever of 105, a BP of 60/40. They packed me in ice packs and started a sepsis protocol. I was so dehydrated, and had poor kidney function from the low BP, that I had received 4 liters of saline before I produced urine. Turns out I had been suffering from severe Crohn's disease for months, and had a perforated colon causing all the other symptoms. The reason I even told the story here is because the nurses all agreed they had never seen anyone with a BP that low not die. Story 31 not a medical worker, but after one of my kids was born, my ferritin was at 4, the midwives thought the result was wrong and tested again on a different machine which gave them 3, 8, normal is apparently 13, anything under 8 and they start to consider a transfusion. They said it was surprising I was still mobile and not feeling too bad. Several units of blood later and a day on the HDU it got up to 7. When I went back for a booking appointment a few years later, I told them I had a transfusion but I had felt fine and the MW said we had someone a few years ago who went down under 4 and she was still managing fine. Yep, that's probably me. Story 32 got a call from the doctor asking if we had life insurance on my husband because his triglycerides were 2,600. The lab had retested multiple times. This was 25 years ago, and he still struggles to keep them in the 3-digit range with very expensive medication. Story 33 reading a bone marrow aspirate and found what ended up being histoplasmosis capsulatum. Everyone related to hematology was in my office that day. Many extra slides were pulled and stained for personal collections. Story 34 hemoglobin of 2. I thought it must have been extremely diluted or that I had missed a clot when I ran it, called down to ED for recollection. It was 2 again. I called one more time to talk to the nurse. This result is incompatible with life. Are you sure it was drawn below the 4 line, that it's not contaminated? Oh no, 2 makes sense. The patient is covered in bedbugs, scorch, EXE has unexpectedly crashed. We pumped like 4 units of blood into the patient, but they still didn't make it. Dude got eaten alive by bedbugs. Story 35 a genetic test that came back XY on a patient with a clear vulva and no penis. Edited to add that we sent another blood test to a different lab to confirm there was no error. There was no error, the child was male, but had a vulva and no penis. Gender is truly a spectrum. Story 36 my then 15-year-old daughter needed a bone marrow biopsy to figure out some weirdness with her blood counts. And both the samples they got were pale yellow. They took 1 sample from each of her hips, and found 2 living cells, total. The rest of the cells were dead and completely unidentifiable. Apparently, they can sometimes tell what dead cells used to be. No idea, they just told us we don't know what's going on, but this isn't a good sign, so they gave it another try, and did 5 samples from each hip, no living cells whatsoever. Then they decided to try other bones. The sample from her upper arm was also completely dead, but the one from her shin wasn't. It was however 94 leukemia AML, that was in 2018, she spent most of 6 months in the hospital, but made it through and is doing well now. Story 37 a blood sugar level of a little more than 2,400, normal being 70 to 100, Patient was a frequent flyer with uncontrolled diabetes, and did end up dying at the end that hospital stay. Patient was only in her 30s. Story 38 once drew blood from a parrot that looked like it was scrambled egg yolk, very thick and yellow. Generally blood looks just like human blood. Don't remember the results of the blood work other than its liver was shot. Story 39 So I take my kid to the pediatrician for checkup. Blood pressure comes back high, scary high, like stage 2 hypertension. They take multiple measurements with multiple instruments and confirm. Obviously, this was very concerning. We get a home BP monitor and instructions. Call the school nurse to talk about monitoring during the school day. The appointment ends. Kid runs to the bathroom. Turns out was holding in like 2 subway footlongs and just really needed to take a dump. Everything was fine. Story 40 I walked into the ER with a white count of 30,000. Actually drove myself to the ER. Didn't know it, but I was septic due to having the flesh-eating bacteria. Story 41 Not a medical worker, but a patient who gave quite the shock to his doctors. ID managed to crack my head on the landing as I was going up the stairs with quite some force whilst hurrying to try and sort some things out. Took a chunk out of the brickwork, and felt fine bar the pain from where ID hit it. Went to work a few hours later, and as I was starting my shift, dropped to the floor like a sack of spuds according to the member of the team who ID been talking to at the time. One ambulance ride and an x-ray later. It's revealed I had what could best be described as a spiderweb of hairline fractures going across my skull from where ID bashed it. 5 months off work for the contusion to go and the fractures to repair themselves to the point where I was declared fit to work, though had to take it easy. Still I returned to work to a lovely welcome present from my oh-so-loving team. A bike helmet and multiple boxes of painkillers. Story 42 I was the doctor covering a psychiatric hospital on night shift. At the tail end of the shift, around 6 a.m., nurses from one of the old age wards called me saying one of their patients had been complaining of chest pain since midnight, but they didn't want to reach out at that time as they didn't think it was so serious to disturb me. I go check the guy out, and he is looking chill and saying his chest had been hurting a bit overnight. I take a heart tracing from the guy and it's showing global ST elevations, i.e. on the terrible end of the spectrum of how bad a heart attack can be. Took a blood sample to check troponin, a chemical used as a biomarker for measuring heart damage, and got the guy sent to the nearby general hospital as quick as I could. That blood sample showed a troponin of around 10,000 ING. For reference, a normal healthy reading is 0 to 14. I made it very clear to nurses afterward that it is my job to be disturbed if someone is complaining of a chest pain, no matter how minor it may seem, even at an unsocial hour. Story 43 CK of 150,000. It was a girl who took a spin class and now her legs are really sore and her pee looks weird. Hemoglobin of 1,9 potassium 9 not hemolyzed. Coded immediately. Story 44 Normal range for adjusted calcium in my lab is 259 mol. I saw a 6 once. I didn't realize having chalk for blood was compatible with life. But hey, a load of 4 fluid and slog of bisphosphonate later, and she was still there to tell me she hadn't pooped for a week. I also once had a patient with lipemia-induced pancreatitis. Her blood came out in the tube and was white with a slight blush to it. It quickly settled into layers with the top 34 being lipid. I don't know what her triglyceride level because our labs kit basically came back as 3.6 Roentgens per second and sent the sample to a central lab for testing. I went on holiday the next day and forgot to follow up when I got back. Story 45 Our daughter has CDA type 2. First time or the children's hematology has seen it before. Stupid rare apparently. None of the labs really figured it out until the genetics came back and everyone was like, really? Story 46 I was in the ER for not doing well for a couple of days. I asked the nurse if she would open the window because I felt a bit warm. Turns out my temperature was 43.9 degrees C, that's 111.02 Fahrenheit. She rushed out to get a doctor. Story 47 got a call from the lab tech that my patient had blue-green crystals of death. The tech said when those show up death is usually imminent. Patient passed about an hour later. Story 48 had a kid who I sent for sleep study. He was desatting to the 50s and was admitted directly from sleep lab to the ICU for emergent tonsillectomy, which was done the next day. Changed his entire life. His previously debilitating anxiety vanished. Story 49 I'm a veterinarian and we use hematocrit instead of hemoglobin because it's more accurate across species, but had a puppy come in oxygen dependent from flea parasite anemia. His HCT of red blood cells was 4% of the fluid in his veins was red cells. It literally looked like red-tinged water. It's supposed to be 35 to 55. Treated the fleas, slammed a few ml of blood and he was tiny, and in about 30 minutes he was bouncing off the walls because he could breathe again. Story 50 As a severe alcoholic, I would eventually end up in the ER for withdrawal, and they would always do a metabolic panel to test liver function. They never told me the results, but I could look up the lab results and most were on the red. How my liver and pancreas still work is beyond me. It looks like the worst one was my scotast. Normal range is 5 to 40 and I was 74. I think this was also when I was septic with MRSA and also tested positive for COVID. Oh, good times. Story 51 I'm not a med tech, but I am a phleb. I had a child with blood that was so thin it looked like a Halloween prop. When I dropped off the sample, the med tech did not believe me when I told them it was real, and not just me covering up some sort of mess up. I don't know what that child's hemoglobin was, but it was scary low. Low enough that the same med tech was surprised they were alive. I have never seen blood so thin before in my 11 years on this job. It was red-tinted water. Story 52 Indian rupees 14 LVAD patient. They're all on Coumadin. The therapeutic range is 2 to 3 WBC0, 1 cancer point with Mets everywhere platelets, 4 probably another cancer point source nurse with experience with various patient populations. Currently in a med surg ICU. Story 53 I was getting an EKG at the Cleveland clinic. My heart rate was 38. After the technician took off the leads he says, you'll be right back, I have to go talk to someone. Well, for some reason after a couple years on my heart meds they started doing this to me. They took me off them Sotalol and my HR returned to normal. I never felt dizzy or in any way affected by the low heart rate. Story 54 I work in clinical trials. This kid came in last week for his routine blood work and his creatinine kinase was 7,800. He felt fine somehow. I work in gastroenterology and have seen fecal calprotectins in the 8,000s range though, sheesh. Story 55 A few that come to mind: blood glucose of 1100 and a pH of 6.98 on an old man who is just sitting there, alert and oriented, and talking to me like everything is good with those labs. He should have been lethargic, confused, and barely opening his eyes. WBC of 0, 1 on someone getting chemo induction, hemoglobin of 3.6 on a woman who walked into the ED and complained of feeling really tired lately. Triglycerides 1200 max the instrument will read. You could see the fat in the lab tube after the blood draw. Story 56 My dad was sent to have films made of either his gallbladder or appendix. Don't remember which. They did the scan and sent it to the surgeon electronically. About an hour later, the surgeon himself calls and says he's on his way to the hospital. My dad needs to come immediately for surgery because it's about to burst. A friend works in the lab and said the surgeon came down and read them the riot act because it was obvious it was about to burst and surgery needed to happen immediately. They should have called and told him there was something he needed to look at right then rather than just waiting for him to get time to look at it. Story 57 EMT here. Once had a dude with a blood pressure of 6,040, but the crazy part is the way he was up talking and laughing, oriented and acting like nothing was wrong. Was weird. I feel like these stories will be on season 2 of The Pit. Story 58 Not a medical worker, but my dad once had a blood sugar level in the 1980s. I spent 2 days sitting with him as he got treatment in the ICU. Everyone thought I was lying when a new nurse would come and ask his blood sugar. I'd be told I must have misunderstood. They'd try a finger poke. It wouldn't work. They'd have to send my dad's blood to the lab. It would come back outrageously high. Apparently, he should have been quite deceased. He got last rites everything. He's 87 now, still diabetic, still kicking. Story 59 Worked hospice for a time. Joint visit with the RN. Patient pulse ox was 18, awake, completely oriented, talkative, not short of breath or any other symptoms. Highest it went the entire visit was 25. We kept trying it on ourselves, different fingers. Nurse even tried toes. Readings on us were all normal. We straight up told the patient and family, we aren't sure how you are awake and talking to us, but we don't think you'll be with us a whole lot longer. Patient and family extremely understanding. Lived another 18 hours talking and visiting with family, ultimately passing in their sleep. Story 60 All sorts of medical problems exist, and my family and I have this weird thing where if I get stressed out at all my blood sugar absolutely plummets. One time at school my head felt a little weird so I called my mom from the office. It wasn't even really enough to bother me too much. It was just like the feeling when your eyes strain too much and a headache is coming, but it's not there yet. My mom is diabetic so she decided to ill her finger and see what it is because I know this happens with her. It was at 31 LMAO. The school nurse panicked so fast and didn't believe me or my mom when we were like, yeah, this just happens sometimes, just get some juice. If you don't know, normal is supposed to be between 90 to 110. I've never had high blood sugar in my life, and my doctors are well aware of this so don't worry. Also that time at my PCP's office when they were doing my vitals check and sitting down for over 10 minutes my heart rate was 240 something. Texted my mom in the parking lot like, oh heads up, they might not let me leave. So be prepared, genetics are a fun thing. Story 61 I'm not a medical worker but I am diabetic so I have to check my glucose frequently. Once at work I was checking before lunch and a coworker who hadn't been feeling well asked me what I was doing so I explained. She was young and in good health but was curious so we checked her glucose too. It was 16. Story 62 My husband, at 33 and no extra weight, stopped breathing about 70 times per hour. He has worn his CPAP religiously for the past 20 years. He falls asleep with his mask on and I'm in bed with my retainer in and a skincare mask on. We're the sexiest middle-aged couple ever. Story 63 Last year I was admitted to hospital due to a reaction to my immunotherapy grade 3 dermatitis. Head to toe, needed 4 steroids. I felt like absolute. On one of my routine OBS a couple of hours after lunch, the nurse measured my blood glucose as 2 for ml. She said, oh that's low, how are you still conscious? She asked me how I was feeling and I was like, well pretty crappy, same as I have this entire time. She made me have some sugar syrup from a sachet and then measured my blood glucose every 2 hours for days until they chilled out. Story 64 The 2 I can recall I had a 1,2 potassium come in from an outside facility. I rolled my eyes and called them to tell them it was contaminated as there is no way someone can have that and be alive. They bring the patient in, a young man in a wheelchair who seemed perfectly healthy and confused as to why they brought him to the ER. Our staff redrew him and he had a 1,3 potassium this time. Turns out he has hypokalemic periodic paralysis or something akin to it. As long as his potassium is low, he couldn't use his legs. The second I recall was we had a blood culture go positive after only 4 hours on Thanksgiving, which is very unusual. Our biofire didn't ID what it was, but only the anaerobic bottles went positive. The ED called the patient's family and told them to bring them back in. The family waiting until after dinner 3 or 4 hours later to go to the PT's house and found them in a chair absolutely out of touch with reality. They bring her in and we go and draw labs. We spun it down and took it out of the centrifuge, and though we'd forgotten to hit start because the whole tube was dark red, we respun in and it was the same. We noticed the gel separator was in the middle, but both half of the tube looked like whole blood. Our tech, who used to be a microtech at her previous hospital, saw that and was like Clostridium perfringens. We called a pathologist and tried to get the ED doc to call him to advise him, but sadly the several-hour delay their family took resulted in her passing away. When they were in the first time, they were just feeling a little sick and had thrown up at work. They didn't make it. Total Clostridium perfringens sepsis. Story 65. I have a record going in my phone. 1. A1C20, 1-2, BMI 115-3. Lactic acid 31 alive and lived 4, platelets 5-5, lactoferrin 6,786, triglycerides 10,080, acute pancreatitis 7, sodium 183.8, ammonia 538. Story 66. I work in the cath lab where we check the heart arteries of people and place stents, fix blockages if needed. We also fix heart attacks and a number of other things, but anyways, my coworker's 57 years old dad was having chest pain sometimes. Dad in question was pretty skinny, not a smoker, but coworker son convinced him to have a cath. Coworker came to me personally and told me he asked my boss for me personally to be on the case. I felt a great honor from that. There are 3 arteries that give blood flow to the heart, though they start as 2 in most people. The RCA feeds the bottom of the heart, and the left main splits or bifurcates into the L80, also called the widowmaker, which feeds the front of the heart, and the LCX, which feeds the back and side of the heart. Coworker's dad had a 99 left main blockage that also lead into a 99 blockage in the start of the L80 and in the start of the LCX. It was one of the worst blockages I've ever seen, but made worse by the fact that we all knew this guy's son could see exactly what we were seeing. We worked quickly to put a cardiac support pump in and transferred him to the ICU, and they did CABG open heart the next morning on a Saturday. Stents were possible, but just too risky with the severity of the blockage. If something went wrong, at least 23 of the heart's blood supply would be compromised. Luckily surgery went great and he's still kicking, but it was a moment I realized how much I really cared about my coworkers. Story 67. Obligatory, not an MW, but was once brought into the ER with a heart rate of 32. Blood pressure 60/40 and temp 34C. It turned out to be a bowel blockage that thankfully resolved itself without surgery. I did overhear one of the nurses say she'd never seen that much come out of a person. Eat your fiber, people, and drink the water. Constipation is not to be fooled with. Story 68. Many unfortunately. 1. Platelet count 13,000. Old dengue fever. 2. Heartbeat 200. 2 to 3 years old patient. It was a long time ago, so I'm unable to recall the diagnosis. Maybe it was congenital adrenal hyperplasia. 3. HB3 MGDL. Also a 2 to 3 years old patient. I took her sample and it was like red-colored water. She died after a few minutes before a diagnosis, and cause of her anemia could be established.